The number of referrals by schools seeking mental health treatment for troubled pupils has more than doubled in our region in just 3 years, shock figures have revealed today. In a Freedom of Information (FOI) request to NHS Trusts in the Midlands, the NSPCC found schools seeking help for pupils from NHS Child and Adolescent Mental Health Services (CAMHS) made more than 15,000 referrals since 2014-15. Nationwide, 123,713 referrals were made in total in the same period. Worryingly, 56% of referrals came from primary schools. It is thought this could be due to a lack of funding and services to support children in those settings. But NSPCC research shows nearly a third of referrals from schools to CAMHS were declined treatment as they did not meet the criteria for support. Midlands Trusts who responded to the NSPCC's FOI request included Birmingham and Solihull Mental Health NHS Foundation Trust, Birmingham Women's and Children's Hospital NHS Foundation Trust, and Coventry and Warwickshire Partnership NHS Trust. File image, John Chalicom, Childline, PA Wire. Some young people have told Childline that they only received specialist support when they reached crisis point, and have even asked Childline counselors to act on their behalf to get help quicker. Due to the rise in mental health counseling sessions the charity delivers, they are calling on government to increase the amount of funding it gives to Childline, to ensure it can reach even more children who are struggling. Peter Wanless, chief executive of the NSPCC, said, "Our research shows schools are increasingly referring children for specialist mental health treatment, often when the child is at crisis point. SPCC issues advice to parents over Fortnite Battle Royale sweeping the UK. Childline plays a vital role in supporting children with their mental health, and many turn to us when they are struggling to get access to specialist treatment. Early counseling from Childline could also help relieve the pressure on CAMHS. We have seen a marked increase in counseling about mental health, and fully expect it to continue. It is vital that government urgently provides more funding to Childline and help children who don't have access to support elsewhere." Dame Esther Ranson, founder and president of Childline, said, "Young people are telling us they are overwhelmed with mental health issues, such depression and anxiety, which is taking many of them to the brink of suicide." Esther Ranson with Childline volunteers at their Hagley Road base. "Our counselors are literally saving lives, and it concerns us that we cannot help every child who desperately needs us. We must make sure that Childline is adequately funded so it isn't left vulnerable and can be there for the children who have nowhere else to turn." Last year, a government green paper promised a shake-up of children's mental health support with an injection of £300 million. Through these reforms, the charity urges government to recognize the vital role played by voluntary sector services in supporting children's mental health, particularly when statutory services are overwhelmed or schools don't have the expertise to deal with complex mental health issues. Last week the NSPCC and 4 of their young campaigners handed in a petition of 22,411 signatures to No. 10 Downing Street to call for increased funding to Childline as part of their Are You There? Campaign. Figures for the Midlands Trusts who responded to the FOI request.